Social participation is a way of making patient engagement systematic and comprehensive and sustainable in health systems. Social participation is a way of institutionalizing that the voice of people with lived experience, patients, civil society, community as a whole, make decisions related to health in their countries. It can be a really powerful avenue for patient engagement and make sure that we are making the decisions that are affecting our health.
I think in the New Zealand context, we have the legislation, we have the structure, we have the willingness of people to want to make sure that patient engagement is included in terms of the design of the health system. There's also the challenge of scarce resources and the need to think about how those resources can be shared. Patient engagement is not merely something that is a nice to have, it's absolutely essential. And I think that being at PEOF for the next few days will bring me back some of those tools to remind our system about how essential patient engagement is for high quality healthcare and to really serve people, both in New Zealand and in our region.
Patient engagement is not only important for healthcare systems under siege. Actually, we should have taken patient engagement much more seriously before that, because in involving patients, in giving them a role in the official healthcare system and supporting them to advocate outside of the official healthcare system would have strengthened the commitment to health at a point in time when there wasn't a crisis. Right now, the important thing is to really engage in creating structures for patient participation, but also for patient organizations to reach out to other organizations that are threatened at this point in time. For example, equity is a key issue for healthcare, and social justice organizations are very active in this sphere of the rights of people, the social contract that we need to re-establish to involve everybody. So it's a time to create something new and to really move forward together with others and to insist that one becomes part of the formal system of how we decide on healthcare and how we deliver healthcare.
I think it's important because at the end of the day, this community, but also more largely the communities that we're all serving and the world population, we need to better understand how we are individual partners in our own care and how the things that we learn as we care for ourselves, for the people in our lives and for our larger communities translates into real change and transformation at the global scale. I think it's just incredible to see how all of these levels connect to one another and how we can really move it into real transformative spaces so that we can make a difference.
I work as the Patient and Public Strategy Editor at the BMJ, so I lead all of our patient partnership work across the journal. We've had patients involved in our work across all that we do for about 10 years now, and so I really challenge the journal to think about how we can involve patients across all that we do and how do we make sure that our content is relevant and accessible to patients as well. Yeah, I think it's really challenging to kind of quantify the impact. We often get feedback from our patient authors that they feel that they've been recognised. Many come back and will tell me that they've had new opportunities to speak, to go and talk to their local decision makers, all as an impact of having a publication in a big medical journal, which is amazing to see. We also get to see the impact in our patient and public reviewers. I love coming to events like this where I just get to meet them and they'll talk about how doing a review helped them learn something new about their condition, gave them access to the content which they could then use to help kind of inform shared decision making for them and their communities.